everyone. Thank you so much for joining us for this next episode of Aestique Plastic Surgeons Secrets to Looking Your Personal Best. Today, we're going to be talking about facial rejuvenation. So what we're going to dive into today are the most frequently asked questions about the facelift procedure. Who is a good candidate? How does it correct the face? And how exactly is the procedure performed? We're going to talk about what has changed throughout the years and how long that results last. Joining me again today are board-certified plastic surgeons from Aestique Plastic Surgical Associates, Dr. Theodore Lazzaro and Dr. Linda Camp. Welcome to you both. Thank you so much for joining us on this Thursday evening.
Well, thank you very much. It's good to be with you and everyone else. Thank you for joining in.
Yes, and thank you for your time and just hearing about all the wonderful things we can offer to you at Aestique Plastic Surgery.
Well, let's jump right in, and I'd like to ask you, Dr. Lazzaro, what exactly does a facelift fix?
A lot of patients ask that and ask, what does it do? And if we can go to this first diagram, this will demonstrate the different areas that we see and where people come in where they're most troubled. A facelift really takes care of from the base of your nose down. So that parenthesis, the cheeks, the jowls, and the neck. It doesn't really address a facelift by itself, the eyes or the eyebrows or the forehead. So the primary area is to, where you can see, tighten the skin if you have loose wrinkles, bring those parentheses back, improve the jawline, and clean the neck. Now, we can give you a case in point here. Let's look at this young lady. She's in her mid to late 50s. She's about 56. And her primary complaint was she doesn't like the parenthesis of her cheek. She doesn't like the fullness in the jowl area and the laxity and puffiness, the double chin area in the neck. So this is really the areas that a facelift targets. What we're aiming to do is to give you more of a heart-shaped face. Fill up in the cheekbone area, give you a clean jawline and a cleaner neck. So now let's look at this young lady on her immediate post-op. She's about 2 weeks after her initial procedure. And you see she gets more of a heart-shaped face, fuller cheekbones, and a cleaner neck. You can really appreciate her neck more on the profile view when you see her side where she gets troubled with the double chin and not having a clean jawline. And this is exactly what a facelift does beautifully. It'll bring those cheeks back, full you up in your upper cheek, clean your neck, give you a better jawline. And on this young lady also, because if she had a little more fatty tissue in the neck area, we actually, while we're doing this, is lipo the neck, thin that out, and then bring it back. You might even notice if you look at her incision lines, just in front of her ear, she has a little bit of pinkness there. She's 3 weeks after the operation, and there's no makeup on.
I'm glad you pointed that out, because another really common question that people ask is, where exactly do you put the incisions?
This has varied through the years as well. And we have a diagram showing in blue where the standard incisions are. If we can go to this picture, the blue area, you'll see it says typical incision line, used to go in the hair up on going towards your forehead. It would come in front of your ear, then back behind your ear and back into the hairline. We've actually do a much shorter incision. If you see the other in black, a short incision technique where we actually literally stay out of your hair. We're going to go to under the sideburn area, come in front of the ear, and then back behind the ear. And if we have to extend that, we don't go into the hair, we go along the hairline behind your ear. Now, what we're going to address, and the reason we can do this with a shorter line incision, is we're going to tighten the layer under the skin. That darker layer you see under the skin is called the SMAS, and it's attached to your platysma muscle in the neck. So when we go and tighten a lower layer, we're going to tighten that up and bring back that parenthesis area, bring back the jowl area, and tighten the neck up. And this gives you a much more natural and longer lasting result. We're not pulling on the skin to try to tighten this. We're doing the layers, the foundation underneath, and it gives a much more natural look. I can demonstrate in this next young lady where she is in her late 50s as well. If you look at her on front view, what she doesn't like is, you see, as we age, our face gets square. It loses that attractive heart shape. She's as full on the bottom in her jowl area as she is up on the top in her cheek area. It's a little bit of parentheses, and we're not trying to erase these. We're trying to, because they are natural, but we just want them less prominent, and also improve the jowl area. If you look at her on the side view, you can actually see where it looks like that parenthesis is going across her jawline, giving her the jowl line, and she has some laxity on the neck. Not quite as much as the first picture we just saw. So we didn't have to do a lipo on her neck here. We're just tightening the underlying structures. Now, looking at her before and after post-operatively, you're going to see where she regains more of a heart-shaped face. So that whole heart-shaped face, which is associated with attractive youth and vibrance, you can see she's fuller on the top, has a cleaner jawline, more of a heart-shaped appearance. And when you look at her on side view, you'll see the same thing where she gets a cleaner neck and a sharper jawline. So that jowl area, that puffiness, just gives her a more refreshed, relaxed look. And that's what we're looking for. We're not trying to change people and let them look totally different. We just want to give them a refreshed, natural version of themselves.
It's very beautiful. And now, with respect to men, are the incisions the same, Dr. Camp, and is the procedure the same that you perform?
So that's a great question, Brianna, because most people don't realize that men are very concerned about their appearance also. For those who are looking for improvement of their facial shape, we do alter the incisions to respect the hair-bearing beard zone of the face. So that's a little different than what we do for women. But we also proceed with the procedure the same. We develop the same flaps. We create the same structural support. We're addressing the parentheses of the nasolabial fold, lifting the jowl. We also want to improve the neck. And in men, as we see in this patient, men will often have a larger Adam's apple or thyroid cartilage we can see on this profile view for this patient. So he had the same concerns as any other patient that came in or client that comes in wanting to refresh his look, but some of his features do require some special attention. And so when we see him on the next picture, we can see his pre and post-op frontal views. So the next picture shows his face on the front. The one on the right is his after surgery view. He has more of a heart-shaped face, softening of the parentheses from the nose to the mouth. His jaw, or the jowl that extended from the cheek onto the neck, is now not visible on the frontal view. And we can even see some softening around his Adam's apple. And this is even more appreciated on the side view, that you can see when we're underneath the skin and tightening that muscle, we can soften those anatomic features so they're less prominent. Just a beautiful jawline, tightening of the neck, again, refreshing the whole facial contour.
Dr. Camp, is there anything that you do before the procedure to prep the skin, or even after the procedure to help maintain that great result that we're seeing?
We certainly do, Brianna. We want to respect your investment, not only in dollars, but your recovery time and your goals that you want to achieve with facial rejuvenation. If we have the liberty of time, we do place you on a pre-op skin prep program. We use the #1 elite medical cosmeceutical line called ZO Skin Health Line. And with this product line, we can start you in advance, even 4 to 6 weeks if we have that much time. We want to improve the cell turnover of your skin for more rapid healing after the surgical procedure. We want to improve the tone of your skin, the surface texture, and give it better hydration. All of these things with a home care skin line can help improve your result, can help its longevity, and give you more satisfied outcome. And we can see this next patient. She not only has the facial changes that she wanted, rejuvenation, the parentheses, the jowl with the squared looking face, the laxity to the neck. She also has some wrinkles about her mouth and the corners of her eye. And most notable are the dark spots that she has all over her sun-damaged skin. So we see the square face look and the brown patches. She is placed on a pre-op skin package that will improve some of the brownness to the skin, but in some patients, such as she, these can be a little bit more stubborn and need an even deeper skin treatment, which would be a surgical chemical peel. We use a chemical agent called phenylcroton that can help lighten these dark brown patches, as well as improve those wrinkles outside of the zone of facelift on the forehead, corners of the eyes, and around the mouth. And on the next picture, we can see her frontal view on her pre and post-op. What beautiful improvement of her skin tone, the skin surface, the hydration of the skin with good reflection of light. She still has a little shadow of some of those brown spots, but we don't notice any of the wrinkles on the forehead or in the periorbital around her eyes or mouth. She will continue on a post-op regimen that will continue to improve these brown spots going forward. And when we see her on the side view, we can see the true power of customization. This shows that not only are the facelift techniques achieving the outcome she wants, but then by adding the next layer of treatment, which would be that chemical peel, we can tighten those areas around the eyes not addressed by facelift, improve the perioral zone, and certainly lighten those brown patches to an even greater degree. So the power of customization, adding chemical peel, can be done really at any age. It's that individual consultation, face-to-face or virtual consult, where we can identify what your specific issues are and make recommendations from the tools that we have.
She looks absolutely beautiful, and she looks so much more youthful, just a much younger version of herself. And speaking of that, what is really the average age that people have a facelift, Dr. Lazzaro?
This has progressed to a younger and younger age through the years. 20 years ago, I remember the average age that I was doing facelift on were age 57 to about 62. As time has gone on, we're seeing that again going to a more youthful age. We're seeing people where the average age now is about 47 to 52. So we're seeing people much younger, where they're starting to see the signs earlier on, and it does really refreshen them. They don't want everything to come down and then bring it back. They want to just maintain a refreshed look. As one patient said to me years ago, she said, I love my mother. I just don't want to see her in the mirror. So having and maintaining a refreshed look, I thought that was a cute way of putting that. Let me show you this next slide. This young lady, and she is young. She's 47 years old. And when you look at her, she's a very attractive woman. And you say, my gosh, she really doesn't need anything. Well, what she doesn't like is she doesn't like that she's starting to see she's getting more jowly, and it's becoming a little more square. It doesn't have that sharpness to her jawline that she's been accustomed to, and she'd like to just maintain it rather than have it continue progressing. And on her side view, you see a little bit of the jowling and some laxity of the neck. Not a lot of fattiness in there. She doesn't have a double chin, but we're going to do a refresh lift on her. And now when you see her before and after from the front, when you were saying, my gosh, she almost doesn't look like she needs anything, you can appreciate a dramatic difference where the heart-shaped face is restored. She looks a more refreshed version of herself. She gets a nice sharp jawline, and when you look at her on her side, a cleaner profile. And when we look close on the side, this young lady is only 2 weeks after, and you can see even under the hairline with no makeup on for the picture, we can see her at 2 weeks where she's a little pink there, virtually with a little makeup. You don't see anything there at all, even at this early post-op period.
Now, this procedure is different than a mini lift. Is there a true candidate that would be someone who could have a mini facelift procedure?
Well, I'm glad you brought that up because some people come in and I like to have a mini lift, not knowing really what that is. And what a mini lift addresses, when we talked about the facelift, would address the things that mostly occur, where you see the parenthesis and the jowls and laxity of the neck. Some people are seeing this even earlier, where they don't like the parenthesis area and the jowl, and there really is not any appreciable laxity of the neck. So in that case, you do a mini lift, which just addresses the face, not the neck at all. So the parenthesis and the jowl area, and your incision will just be anterior. You really don't go behind the ear much at all, because you're not taking any of that, trying to sharpen the neck. And that's really what a mini lift is. It's not a very common modality that we utilize because most people age as a unit, and there is some laxity that they actually thought was taken care of with just doing what, quote, a mini lift is. And we do a little more to sharpen the neck and have them age naturally.
Great answer. So we know that techniques evolve through the years. What has changed with the facelift procedure?
Initially, a facelift was just a little bit of a skin procedure where you would just excise a little skin, almost pinch it, if you will, and pull it back. Then as time has gone on, we've gone down, as we've demonstrated on an early diagram, where we've gone down into a deeper layer and bringing that and tightening that up, and that is attached to the skin, so it brings it up, and it also gives you more longevity. It lasts longer. So for years, we went from just the skin to down deeper and bringing it back and getting more longevity. But what we were doing is tightening aged skin. So as time progressed, we transitioned into, as Dr. Camp pointed out in our last picture, where we started getting more aggressive with the skin and doing things just in the spa, where you can actually help rejuvenate this. And if you needed something stronger, we would do some peels. So now we're tightening the skin and helping rejuvenating. So we're tightening and rejuvenating skin. And the latest in this progression, which has given us another tool in our armamentarium for facial rejuvenation, is doing fat grafting, where we can take fat from a part of the body that you don't want, so you get almost a double advantage, contour that, and then utilize this fat as shown scientifically, stem cell laden, which helps not only sculpt the area, but help rejuvenate it further. Case in point, let me give you an example on this young lady. The facelift procedure helps address the parenthesis, the jowls, and the neck. Now, something else on her, where you can see she has what we call tear troughs or deflations around her eyes. Years ago, we would go and we would do some sort of an incision, like a blepharoplasty, make an incision and tighten it up, and it would tighten that skin, but that structural tear troughing, where she's actually flat between her eyelid and her cheekbone, is her bony structure. We really didn't have a tool to deal with that until we've gotten into this fat transfer. And we do that with no incisions. This is just done through a needle prick where we'll place that in and then very meticulously contour that across the eyelid, the lower eyelid junction and the cheek to help build up the cheek and blend it into the face. So on this young woman, what we're going to proceed with, and you can see she's only 52, we're going to do the facelift as we've showed in previous pictures, but now in addition, we'll take fat and took some around her tummy. We can take some from different areas where people don't want it and put that in at the same time. So now let's look at her post-operatively. We're going to see the refreshing in the jowl area and the parenthesis coming out. And again, we don't erase this area. We're just bringing it back because it is a natural look. But now blending the eyelid to the cheek with fat that we've taken from her tummy and in real time prepare that and place that in and blend it across. So it really heightens her cheekbones, picks her up, and really brings more of a heart-shaped outline to her face. Let's look at her on the side view as well. So here we have, again, we're going to bring the jowl back, clean it, and then blend it. You appreciate more that blending on the front view, but you can see on the side, she gets a nice, clean look to the area. And on her, she's 7 weeks after the procedure.
Well, looking at that and seeing all these changes, how have they really enhanced the facial rejuvenation procedures that you do at Aestique?
Customization was a word Dr. Camp used. I like that word because what we do, we individualize it to the patient. So we can look at what's happening. Now when we have different tools, before, if you thought you had to do a facelift, you might not have to do that. You can do something else. And let me show you this young lady. She didn't like the appearance of her upper eyelids. Now that would be, remember, that's not taken care of with a facelift. We're going to do an upper lid blepharoplasty or lid tightening. On her lower eyelids, she has some of that tear troughing, a tired look of the lower lids. Now, the cheeks where parentheses, jowls, and neck are, they're okay. So we really don't have to do a facelift. We can use these other tools now. And what we did on her is did an upper lid blepharoplasty, took some fat out from an area where she didn't want it, prepared it, and then blended it across her eyelid cheek junction. And that peel we were talking about, without making an incision, we can do a stronger surgical type peel, again, getting her on a good progressive skincare prior, and blend it. And it'll just give her a very refreshed look. And there's no facelift, only it looks like maybe she did have that when she didn't. And now when you see her post-operatively, and we're eye-to-eye people. When we talk with each other, we look in each other's eyes and we look at that. So you can see that lid fold is recreated and it gives her a much more refreshed look on her upper eyelid. On the lower eyelid, we blended the fat across her lid to her cheek. She has much more of a heart-shaped face. And then using the peel to tighten that skin, it gives us a modality of doing this without actually doing a facelift. Let's look at her on the side. You have much more of dramatic change from the front view because again, we didn't do a facelift.
And looking at her, is there something to be said with fat transfer in the stem cells that give your skin a glow? Because she looks like she's glowing.
It's been an interesting observation that we've seen, and we used to quote unquote call it the stem cell effect because we would notice as we were doing this, they did have that glow. As Dr. Camp mentioned, we utilized the best scientific skincare products, and we have our estheticians who are the skincare experts as your coach. So we're not just giving you products. There's a back and forth, and you can talk to them and say, this is what's happening, and they really individualize it and customize it to you. we would see something over and above now using the fat transfer with the stem cells, where now it's being shown and proven scientifically that these help promote rejuvenation of the skin itself. So not only are we blending and changing the structural change, but now we're helping rejuvenate the skin.
Just beautiful.
And if you put all these tools together, all the different things we've been talking about, if we can bring them all together sometimes in the same patient. And this woman didn't like, no, she has the wrinkles between her forehead, the 11s, the laxity of the upper eyelid. She has the tear troughing, doesn't have the high cheekbones. She has wrinkling around her mouth, the parentheses, the marionette lines, and the laxity of the neck. So now all the tools that we're talking about, we're going to put together in one person. We'll get her on the good, aggressive skincare program that she does at home and continues pre and post-operatively. Botox to her glabella area. She'll have the upper eyelids, a blepharoplasty to recontour her upper eyelid fold, blend the fat across her lower lids and cheeks. Around the lower eyelids, we peel that to tighten the skin and then do the peel around her mouth to help smooth the wrinkles out around there as well, along with doing the facelift. So we're combining all the tools of the rejuvenating skin, of the tightening, and of the sculpting with the fat. Now let's look at her pre and post-op. She almost gets a mother-daughter appearance because she'll have the heart-shaped face, a more refreshed look, the blending of the eyelids and the cheekbones, where you see much higher cheeks. And again, we didn't mention, but the fat that you put in there is virtually, by and large, permanent. So when we're taking this out, this is something that doesn't resolve with time. We can do some of these things with fillers, and they do a very excellent job. The advantage is there's not a procedure. The disadvantage is they're more temporary. Fat that we take out and do the transfer, 2/3 of this virtually has shown to be permanent. And I see people 2-3 years later who still have this same contour with that blend. And then we have a profile view of her. So you can see where the facelift has helped tightening the neck and giving her a good jawline, and she gets a good just blend there. The rejuvenation of the skin and the vibrance and brilliance of it, and a rested, refreshed look.
Definitely has the mother-daughter type thing going on. It's really amazing to see. And you're talking about how long the fat transfer lasts. How long, Dr. Camp, do you see most people having the facelift procedure lasting for them?
Well, you know, Brianna, there are many branded titles of rejuvenation procedures on the market. And we at Aestique want to offer only those that really have good science and research behind them. And for example, there are short skin incisions and lunchtime facelifts that do just what Dr. Lazzaro talked about, where they just pinch up a little bit of skin or maybe put a stitch or two in to tighten. The longevity of those results are very limited, yet they're still priced out as a surgical procedure. There's a new technique on the market, it's been around for a little while, but we've done our research on it, that's called a thread lift. And our advanced providers are going to be trained in the near future to be able to offer this to some of our clients who might need just that little touch to hold off from a full facelift. The longevity of those results are going to be close to a year. Again, our research has showed it's a reasonable, good procedure, and our advanced practice providers in the spa service line will be able to offer that in the near future. But if you do have a classic structural support facelift, as Dr. described in the one picture, the artist rendition, where we tighten that deep structure, the SMAS, and then redrape the skin gently across that new supported structure of the skin, we would expect those results to last at least 8 to 10 years, and some patients even longer. So the investment is definitely worth the result. And who you see in the mirror today, we would expect you to see that same face looking back at you in about 10 years.
You know, the interesting thing with that, as you just mentioned, I would see a number of people now after a 10-year period of time coming back, and we would look at them because now they just want a little refreshing, a little bit of tightening just to maintain the look. And when we go back and look at their pictures from 10 years prior, they actually, even at that time, they look better 10 years later than they were before. Yes, we need to do a little tweaking, but they still maintained a nice look. And when they see the pictures, they comment on the same thing. So this type of facelift, you should get a good 8 to 10 years, and then you start coming back to where you were when you had it done initially.
Let's jump into some frequently asked questions. And one big thing is, we all know that there are some celebrities that we see and they have this very tight pulled face. What kind of, is that a facelift procedure, or what is going on with that they have that look?
I think, and you're right, a lot of people, they can even name the names of the celebrity and tell you who it is and look like that. And what that is, it's more of doing more of a skin lift, where they're going on and really pulling it tight because they're really trying to get every little wrinkle refined and pulling harder on the skin. And what it does is it just gives you a windblown look. It doesn't give you a natural look. It's more difficult, more technically demanding to do this on a deeper level. You have to really honor the structures that are there, and you have to really know your anatomy and know what planes you're in. But when you do it in this area, it looks much more natural and lasts much longer.
Because like you were mentioning, we're not trying to erase, you just want to soften. And I think it's good to bring up credentials, because you need to go to a plastic surgeon that's board certified and has the logos that we're looking for. Would you two like to comment more on that so we can educate people on why they need to do that?
The beginning slide showed the logos that really represent quality performing physicians. The ASPS logo, the ASAPS logo really are the elite of trained plastic surgeons and trained aesthetic surgeons. Even our surgical center is an elite program with the Quad ASF credential that goes above and beyond what medical credentialing does for standards. So we do offer the best that you can have, and you should feel confident knowing that you're coming to the best when you attend at Aestique.
The credentialing is obviously, we're going to do a show in the future on one of these webinars, which is going to be talking about credentialing and really honing in. And I did a TV show, as some of you may or may not remember, but for 11 years. And the whole purpose of the show was a format like this. We would talk about different subjects, but it was trumpeting credentialing and talking about how you can find, no matter where you are in the country, the type of credentials that really signify people who do a lot of these procedures and are trained to do it. And it doesn't mean that you can't potentially have a complication. The only person that doesn't get complications in this, it doesn't live in this world, it's somewhere else. But we can do that. They're minimal. And when they do infrequently occur, we know how to treat them and get a good result in the process.
I think that's so important for people to know that. And we do have a question from Dawn. Dawn is asking, I am 70 years old. Am I too old for a facelift?
My answer is definitely not. Well, let me just put it this way. The oldest facelift that I know that I've done was 87, then had a refreshed version. And she said, I've been wanting to do this for years and years. And I just think I'd don't look the way I will want to look when I go out dancing. I said, well, that's wonderful. But no, absolutely not. It's not a chronological age number. It's more the person, and we're living longer and longer, taking care of ourselves, and we want to look like we feel.
So in our preoperative assessment, it's our responsibility as your surgeon to look at the risk-benefit ratio and to give you our best judgment about the procedure, the risk and the benefits to you, and age is not part of that criteria. So I don't think you're ever too old to want to look as good as you feel or to look as young as you feel. And if you're a healthy individual and can tolerate a surgical procedure, a facelift would be very much something that you should consider.
Thank you, Dawn, for that question. We hope to be seeing you very soon. And another common question that a lot of people ask is, how much time should they take off for recovery for a facelift?
What I tell them, if you have something to go to, a special event, and you want to be seen, you're at a wedding, you're at a graduation, you should give us about 3 weeks. For standard things of just being out in the public eye, it's anywhere from you might have to use some makeup. Within 10 days to 2 weeks, you can be in the public eye without anybody knowing that you did anything. And some of the pictures that we've shown earlier, as I pointed out, this is a 2-week post-op. But you can be in the public eye at that time.
Something also I'd like to point out on that, you had mentioned you could use makeup. All of our facelift patients that come through Aestique, you will get 20% off of all of the ZO Skin Health products for life. And we also have you meet with our esthetician, who will kind of be your coach and your guide, and she will help you preoperatively to get the right products in place, and postoperatively to guide you through keeping that result looking as well as it can. Now, as far as the makeup, they match you with our Jane Iredale mineral makeup line, and it's great. So any residual bruising that you have, this is mineral makeup. It's very, it's safe to put on your skin after, and it will cover everything up, and it's absolutely beautiful. And that's all included in your facelift package. Another common question that we hear is, will my face be numb after the procedure, or how long will it be numb?
One of the complications that can happen with a facelift is the nerve that brings feeling to the ear. Dr. Lazzaro nor I have ever seen a permanent loss of feeling to the ear. But when we lift the skin the way we do, the sensation of the skin is limited until those cutaneous nerves all grow back in. So you'll have numbness in the area like in front of the ear. That's very common. That should recover within several months. You should be back to normal.
Sometimes we'll notice that more with gentlemen who will bring it up, that they still feel a little numbness because they notice it every day when they're shaving a little bit. And it's something that Dr. Camp just mentioned. This does resolve, goes away on its own. Now, usually in a 6-week period, 6 weeks to 2 months.
Oh, wonderful. And we really hope that all of you have enjoyed hearing about all of this, and we want to continue the conversation. So we invite you to come in, schedule your complimentary in-person or virtual consultation today. You can email info@aestique.com, and we would be happy to get that set up for you. And as a special gift to you from Aestique, you will be receiving a $500 gift off your surgical fee for a facelift procedure. Just a couple of reminders I want to let you know about. We, as you know, this week we started our new time. We're doing Thursday evenings at 7 p.m. And next week, we're kicking off our next episode of Aestique Plastic Surgeons Spilling Their Secrets and talking all about springing into your summer body with body contouring. And that, again, will be next Thursday at 7 p.m. And Dr. Camp, if you'd like to maybe just give a little plug on that, what we'll be hearing about?
Well, we just want to talk about contouring your body to get rid of those areas of lipodystrophy, those fat pockets that are resistant to diet and exercise, that maybe just keep you from reaching that perfect look that you're trying to get. Liposuction, liposculpture is the way to get you there. And we look forward to educating you more on that procedure with our next webinar.
So exciting. And we have some really big news. We have decided to customize content for everyone based on what people want to see. So we are creating a new social media page. Actually, we have created it for Aestique Plastic Surgery. So this page will be focused on before and after pictures, some videos, a lot of great education coming from our 2 board certified plastic surgeons that you're seeing with us today. And you can see here, we do have the link. The Aestique Facebook page will be Aestique Plastic Surgery, and same with Instagram. So please come and follow us. We are having a big event to try and boost our followers. So like our new page and share the post, tag 5 friends, and you're going to be registered to win an iPad. And it's a great iPad, and you're going to be able to get this great content from everybody. So we really hope that you join, and we'd love to hear your feedback on what you would like to see on the page as well, so drop us a comment. You'll see here's our social media links on Facebook, on Instagram, and YouTube. We're at Aestique Medical, where you can see all these great webinars that we do, and so much more. And I want to turn it back over to you, Dr. Lazzaro and Dr. Camp, just to say a nice goodbye.
Well, thank you all for attending, and we hope to see and talk to you soon. And best wishes to you and your family to stay well, stay happy. The best is yet to come.
Thank you for attending, and we look forward to meeting you.
Thank you all so much for attending our webinar. We enjoy having you, and we enjoy producing this content that you hopefully find very educational and helpful. And until next time, we hope that we help you live life counterclockwise. Good night.
Good night.
Good night.